Okay, so very good morning to all my dear students. I welcome you all into the industrial pharmacy first. Okay, dear student. So today we will going to discuss about the new topic, that is the cosmetics, right? So as far as the cosmetics are concerned, as you know that this is the very popular kind of the preparations, right? So although we are the student who are dealing with that of the pharmacy, who are dealing with that of the pharmaceutical preparations, who are dealing with that of the dosage forms, but the method of preparation of all these cosmetics and all, again it is similar to that of these pharmaceutical products. So these cannot be properly called as the dosage forms, but these are the special kinds of preparations that are used in order to beautify, in order to enhance the appearance of an individual, right? Now if we just want to talk about the cosmetics, let's have some of the general discussion. As I said, that the cosmetic, that is the very common, very popular kinds of the preparations, and these are very popular among the women's, among the girls, among the young age females, right? Because see, the requirement is or everyone that wants, that they want to look beautiful, they want to look good, right? So few they will be having this god gift as far as the beauty is concerned, and those who don't have this god gift, so they can go for enhancing it artificially. Now in order to enhance it artificially, they have to take the benefit of, or they have to take the help of all these kinds of the preparations. Now if you see, as far as the number of cosmetics are concerned, there are n number of preparations. You just take any part of our body, you will going to find the particular preparation that is used in order to enhance, in order to improve the appearance of that particular part of the body. So just take from the tip of your hairs onto the head up to the nail of your toe, you will going to find the n number of preparations to that one. For the hairs, you will going to find that there is a shampoo, there is a hair conditioners, there is a hair dye, there is a hair lotions, isn't it? There is a different kinds of the hair oils. For the face, you will going to find there is a face powder, there is a compact powder. If you just look to your eyes, you will going to find the kajals, you will going to find the eye lacquers, you will going to find the eyeliners, you will going to find the preparations in order to beautify the eyelashes, you will going to find the preparations that are used in order to beautify the eyelids, isn't it? Eyeshadows, you will going to having the preparation like say which is to be used onto the cheeks, like say the roses, isn't it, which are called as the blushes, right? Then if you will just come to the nose, you will going to find the preparation which are there in order to remove the blackheads, in order to remove the whiteheads. If you just go to the lips, you are going to find the lip balm, you are going to find the uh, lipsticks, right? And then as you will move to your body part, you will going to find the skin lotions, you will going to find the skin ointment, you will going to find the cold cream, you will going to find the vanishing cream, you will going to find the massage creams, right? You will going to find the hair removers, you will going to find the epilatory preparation, isn't it? So you will going to find the nail removers, nail lacquer removers, you will going to find the nail paints, right? You will going to find the deodorants, you will going to find the perfumes, you will going to find the antiperspirants, right? So as I said, that there are n number of preparation which are there, which are to be used in order to improve the beauty of an individual. So just broadly, if you want to define, or if you want to say what the cosmetics are, these are nothing but the kind of the preparation that are used in order to improve, in order to enhance the appearance of an individual. That might be skin, that might be body part, and the preparation, these are going to be applied onto the body or into the body parts, right? So this is as far as the general discussion is concerned. And in this particular talk, or in the today's and the coming subsequent lectures, we will going to discuss some of the aspects of the cosmetics, in which we will going to explore few of the preparations, like say the cold creams, vanishing creams. Then we will see what are the cosmetics, how these are going to be evaluated, what are the different types of the preparations, how these are going to be classified, how these are going to be manufacturing. So this will be the general discussion associated with that of the cosmetics. Now let's move to the specific details associated with this through our slides, right? So as far as the cosmetic is concerned, the topic that we have to cover in accordance with that of the syllabus that is framed and prescribed by the Pharmacy Council of India. So we have to see the formulation and preparation of the different few of the cosmetics, like say the lipsticks, shampoos, cold creams, vanishing creams, toothpastes, hair dyes, and the sunscreens. So we are going to be applying these onto the skin as well as into the body cavities. We are applying onto the skin of the face. We are going to be applying onto the skin of the body. We are going to be applying onto the eyes. Or we are going to be applying onto the lips. We are going to be applying in order to clean the oral cavities also. Now these preparations, they might be sometime, they will be used in order to treat the various kinds of the disorders associated with this, like say in order to treat the skin disorder, in order to treat the oral cavity disorders, like say the tooth decays and the bad odors, right? Like say the gargles and all, these are going to be used, or say the throat paint, these are going to be used. So these are applied onto the skin, these are applied onto the eyes, and these are applied onto the oral cavities. Okay. So we're going to cover that what are the cosmetics, what are the different types of the cosmetics, what are the different permeations through the skin, that is the different mechanism by which the skin permeation that will occur, and the different kinds of the skin care product. As just now in the introduction we had discussed, there are n number of the skin products. Then we will see the details associated with the cold cream and the vanishing cream. So in order to cover all this, we will move through, like say the introduction to the cosmetics, then structure of the skin. We will see the structure of the skin, the different parts of the skin, the different layers of the skin, and the aspect that are used in order to study that how the process of permeation, or how the process by which the passage of the drug that will occur through the different skin layers in order to treat the disorders of the skin, or in order to improve the beauty and appearance of the skin. Then we will see the classification of the cosmetics. There are different classification based on function, based on the type of preparation. We will see that how these are going to be classified and what it is. Then we will see few of the skincare products, like say the creams. Now, as far as the introduction is concerned, we have to see the definition of the cosmetic. So the general definition that already we had elaborated, but we have to see the very specific definition that is given by the European regulations. Now, as far as the Article 2 of the European Regulation N1223 2009 of the November 30, 2009, concerning the cosmetics product, they had defined the cosmetic. How they had defined? They had defined the cosmetic in such a way that cosmetic, these are any substances or the preparation intended to be put in contact with the different superficial parts of the human body, epidermis, head and body hair, nails, lips, and the external genital organs, or with the teeth and the mucous membrane of the mouth, in order to exclusively or generally clean, perfume, modify their appearance, and or correct body odors, and or protect or keep them in good condition. So all these are the different aspects they will get covered as per as the definition of the cosmetics. So what the cosmetics are? These are the substances, right? Substance, that means that might be liquid, that might be oil, that might be preparation. These are any substances or preparation that will contain more than one ingredient, intended to be put in contact with different superficial parts of human body. These are placed in contact with that of the different parts of the body. So what are these different parts? These are the epidermis, that is nothing but the skin layer, head and body hair, the hairs that are present onto overall onto the body, the hairs that are present or onto the scalp region. So in order to improve their appearance, the cosmetics product these are going to be used. Nails, not only hair, the nails, lips and external genital organs, these are going to be used in order to treat all these, that is the genital organs, lips, nails and the hairs. Or not only it is related with all these human body parts, but with the teeth, in order to clean, in order to improve, in order to modify the freshness of the oral cavity, freshness of the breath and to clean the teeth, these products are used. And the mucous membrane of the mouth, in order to exclusively or generally clean mucous membrane of the mouth, that is the oral cavity, the bad odor, isn't it, that can be removed, that can be treated with the help of use of the throat paints or the gargles, right? Perfume, the perfume that is going to be applied onto the different body part, more specifically into the armpits, isn't it? Into the armpits, these are going to be applied. The deodorant preparation, these are going to be applied onto the armpits, modify their appearance or generally clean, modify the appearance of the face that can be improved, the appearance that of the face that can be enhanced, the picture which is available, that is something different from that of the reality, right? So how this picture that will be appearing different, that is because of the enhancement, that is because of the use of the cosmetics. So without makeup and with makeup, you will going to find there is a great difference, right? So generally the brides, whenever they want to they will become or they will attain the age of 18, or they want to go for the wedding proposals, at that time biodata preparations, at that time they used to go with the application of all these number of the cosmetics, so that their appearance that can be enhanced, so that they can look good, they can, their appearance that will be improved, so that the person or the groom that will get impressed by them, right? Okay, so this is just a matter of fun, but this is the reality that we cannot deny. Okay, so this is just applied exclusively onto the skin in order to improve the appearance and or correct body odor, as I said that in case of the deodorant, right? In case of the antiperspirant, there is a perspiration, along with perspiration there is a sebum, so that is associated with the bad odor. So that bad odor that can be treated, you might have seen in most of the television advertisement also, isn't it? The one who will going to lift up their arms, so there is a bad odor, so no one is there to remain surrounding to them, right? So this can be corrected with the help of use of the preparations like say the cosmetics, and again the deodorant, antiperspirant, these are the kinds of the preparations, and or protect or keep them in good condition, right? We want to protect, we want to protect our eyes, we want to protect our lips, we want to protect or we want to keep them into the good condition. In case of the winter season, there is a cracking of the thin layers of the lips, isn't it? So that can be treated, that can be kept into the good condition with the help of application of the lip balm. So this is the broad coverage of the definition which is said to be the cosmetic, and this is in accordance with that of the European uh, regulations. So you should thorough up, you should mug up, you should enchant this particular verbatim definition for the cosmetics. Now, as far as the cosmetics are concerned, they are going to be classified based on the region where they are going to be applied. Like say onto the nails, there are cosmetic which are applied onto the nails. As I said, the example nail paint, nail lacquer removers, isn't it? Nail enamel remover. So these are the preparation. As far as the teeth are concerned, there are tooth powder, there are toothpaste, isn't it? So that are used in order to clean the teeth, and the preparations that are used in order to clean the teeth, these are properly called as the dentifrices. The preparations which are going to be applied onto the eyes, like see the eyeliner, eye mascara, eye creams, eye lotions, isn't it? Kajals, eyeshadows, all these are the preparation that are applied onto the eyes. So based on the anatomical region of our body where they are going to be applied, there is a classification. For hairs, we will be having the hair conditioner, hair shampoos, and the hair removers. The removal of the unwanted hairs from our body parts, right? So there are the preparations that will fall under the hair. For the skin, you will going to find the different kinds of the preparations, like say there is a cream. As far as the creams are concerned, there is a cold cream, vanishing cream, body massage cream, there is a mosquito repellent cream, isn't it? So these are various creams. There is a foundation cream, the cream that is used in order to act as a foundation onto which the different kinds of the preparations they will going to be applied. Then there is a powder, the body powder, talcum powders, face powders, isn't it? The medicated powders, the anti what we say that Nycil, isn't it? There is a skin irritation, isn't it? So Nycil powder is there, antiperspirant powder is there, which will not allow the process, or which will prevent the formation of the perspiration, or which will reduce the formation of the perspiration just by, not they will directly reduce the perspiration formation, but they will go for absorbing this perspiration or the sweating. Then the different kinds of the lotions, like say the skin lotions, hair lotions. Then you are going to find the body lotions, which is generally applied in case of the winter season. So there is another kind of the classification that is in accordance with that of their function, the function that they will perform. So the classification or the cosmetics, these are going to be classified as a curative, protective, corrective, and the decorative. The one that will cure the different conditions, like say the perspiration, antiperspirant powder, antiperspirant preparation, antiperspiration sprays, right? So these are the curative kinds of the preparation. Protective, face powder or the sunscreen lotions, they will protect the skin, they will protect the face. Corrective, the face powder, in order to correct the various kinds of powders, or in order to hide the skin blemishes, the face powders, these are going to be used. Decorative, in order to decorate the body part, in order to decorate the nail, in order to decorate the hairs, in order to decorate the lips, in order to decorate the different parts of the body, the preparations that are used, these are called as the uh, decorative preparation. And if you see the example, you will going to find there is a lipsticks, there is a nail polish, and there is a uh, nail lacquer removers, there is a lip balms. There is another classification that is in accordance with that of their physical nature, or according to their physical nature, the cosmetics, these are classified as the aerosols, cakes, emulsion, pastes, powders, solutions, oils, and the sticks. As far as the aerosols are concerned, you are going to find the hair perfumes, you are going to find the deodorant spray, you are going to find the perfumes. As far as the cakes are concerned, you are going to find the compact powder cakes, that is the makeup cakes. Emulsions, you will going to find the example of the cold cream, vanishing cream, generally the colds, generally the creams, these are the emulsions. As far as the pests are concerned, you will going to find the toothpaste powders, you will going to find the tooth powder, face powders. As far as the solutions are concerned, you will going to find the aftershave solution, hand lotions. Oils, you will going to find the hair oils. Sticks, you will going to find the lipsticks, right? So all these are the different classification. Now there is another way of classifying the cosmetics. The cosmetic, these are classified as the herbal cosmetics. Nowadays, these kinds of preparation, they will become very very popular. Like say the Meswak toothpaste, or say the Dantakanti, isn't it? The Patanjali products or the Dabur products. All these are very very popular Ayurvedic preparations. I don't want to promote to anyone, but just in order to give you example, I am quoting all these. So herbal cosmetics, as I said, that there are herbal oils, herbal creams, herbal shampoos, isn't it? You're going to find the medicated cosmetics when there is a addition of any kind of the medicinal substance or the active pharmaceutical ingredient in order to treat the particular body or skin or hair type of the disorder, generally the cosmetics are called as the medicated cosmetics. So you are going to find there is a toothpaste for the sensitive, like say the Sensodyne, the best example for hands, the best example, isn't it? So, in order to treat the teeth, then there are medicated oils for the joints. You are going to find there is a Thanda Thanda Cool Cool, isn't it? Navratna oil. Again, I don't want to promote anyone, but just I am giving you the example. Then there are different preparations, like say, in order to treat the pain, we are going to be using various kinds of lotions, like say the calamine lotions, and for skin problems. So, in order to treat the disorders of the skin, the preparation are going to be used. These are called as the medicated preparations. And some of the general kinds of the preparation that anyone they can use just in order to improve the beauty or the appearance of an individual. So these are the general preparations. So as far as the skin is concerned, the skin has a wide variety of the functions, the different kinds of function. As you know that there is a regulation of the body temperature, there is a protection, isn't it? So there is a sensation. All these are the different functions, and you can see that this is the general structure of the skin, where you will going to find the different structures, like say there are different layers, epidermis, dermis, then there is a fatty tissue, then there are in the skin you will going to find that the skin that is innervated by the nervous tissue, it will contain the follicles, hair follicles, it will contain the sweat glands, oil glands, right? So as far as the function is concerned, it will protect the organisms from the water loss just by regulating the hydration, or just by maintaining the hydration of the skin surface. It will protect the skin from that of the mechanical, chemical, microbial, and the physical influences. Now, so what we saw up till now, that is the introduction to the cosmetic. What are the cosmetic? The definition of cosmetic as per European regulation, and the different way of classifying the cosmetic preparations, right? Then you can see this is the detailed structure for the skin. The you are going to find that there are blood vessels, there are arterioles, there are venules, there are the uppermost skin layer, that is the epidermis. Then below the epidermis we will going to find there is a dermis, and below the dermis we will going to find there is a fat layer, and fat layer they will contain the different blood vessel from where these are going to be innervated into the dermis. Generally, if you see the epidermis, that will not contain any kind of the blood vessel, but that will contain these layers of the skin, like say the horny layer of the skin. So as you will move from the bottom to the top, the hydration that will goes on reducing, and the cells they will move into the forward upward direction, and they will go on becoming flattening, and from the topmost layer they will continuously go on wear and tear. That is the process which is said to be the shedding. So the from skin, the hair they will come out in the form of the hair shaft, tip, and this is the base. So you will going to find in case of dermis there is a innervation of the nerves, there is a sweat gland and the hair follicle, these are located into the dermis. You will going to also find the blood vessels into the deepmost flat layer. Okay. Then you can see the different layers, like say the epidermis. The epidermis, that is the outermost layer of the skin, which will be having thickness of 0.02 to 5 millimeter of thickness, which will consist of the different zones. So the epidermis, this is the magnified view of the epidermis that will shows you the different layer. There is a basal layer, spinous layer, granulosome layer, and the cornified layer. So the basal layer, that is generally responsible for the generation of the skin cells, and you can see these are the basal or the rectangular shaped or the rectangular shaped layers of the skin. And as you will move from this layer to the top layer, you can see they will go and they will go on becoming flattening, and their hydration properties or their structure that will goes on changing. So the epidermis that will contain the stratum germinatum, the germinatum that will contain the stratum basal and the stratum spinosum. Then there is a stratum granulosum, there is a stratum luteum, and there is a stratum corneum. So these are the layers of the epidermis. Then below the epidermis, you will going to find the dermis. So this is the dermis. As I said, that this will contain the innervation of the blood vessels and the nerve endings. They will also contain the uh, what to say, that the glands, that is the sebaceous glands and the sweat gland, along with the hair follicles. You are going to find the presence of the collagen, elastin, and the papillary layer along with the reticular layers in case of the dermis. So you are going to find the papillary region and the reticular regions. The function of the dermis, that is to protect from that of the mechanical injuries. They will go for the retention of the water, and there is a thermal regulation and the sensation. As far as the hypodermis is concerned, that is the deepermost layer, epidermis, dermis, and the hypodermis. So this hypodermis, it is nothing but the hypo. Hypo is the below dermis, below the dermis. The layer which is present below the dermis, that is said to be the hypodermis layer. So this particularly the fatty subcutaneous tissue layer, and that will contain the arteries and the veins into that one, along with that of the fats and the adipose tissue. So it will also contain the collagen, elastic fiber, large blood vessels, lymphatic vessels, and the hair follicle roots. As far as the hypodermis is concerned, it is the subcutaneous layer, and it varies in thickness and acts as a storehouse of the energy. Because of the fat tissue, because of the adipose tissue, it will act as a storehouse of energy. So you can see that from person to person or from region to region, this layer that will goes on differing into the thickness. In case of the rhinoceros, you will going to find that it is very tough, it is very thick, and it is very protective layer, whereas in case of human beings, you will going to find that it is very, very thin. But in case of human beings, if you compare the skin, if you compare the face, if you compare the lips, if you compare the genitals, and if you compare the soles and feet of the palm, so from these region to region, you will going to find these layers and their thickness, that is going to be differing. It is very, very thick in case of the palms and the sole, whereas it is very, very thin in case of the mucus and the genital layers or the genital skin layers. So that is what is the dermis, hypodermis. The hypodermis, it will helps to insulate the body in the low temperature and the environment. So it will act as an insulation. So in case of the winter season, it will not allow to feel the cold much by its alteration. And in case of summer season, it will alter in such a way that, and it will allow to regulate the body temperature. It is also considered as an endocrine organ because the lymphocyte, they will produce the leptin hormone that act as a messenger to the regulate the body weight through the hypothalamus. So leptin, that is the hormone. This is most important. You can see, and you can keep in your mind from the MCQ type of questions point of view. So leptin, it is the hormone that act as a messenger to regulate the body weight through the hypothalamus. So you can see that these are the ways by which there is an entry. So this is highly permeated, that is the transappendageal. Appendages, these are nothing but the hairs or the sweat glands. These are said to be the appendages to the skin. And through these appendages, the absorption of the drugs, absorption of the substances, they will going to occur. It is highly permeable, but it is very, very less. Like say the 0.1% only the percentage for the transappendageal route, like say through the hairs, through the papilla, through the sweat gland, they will get entry, and from there they will get absorbed into the body. There is another route that is said to be the transepidermal. So trans across, epidermis, epidermal, transepidermal, that is across the epidermis. So there is a passage. This is the most prominent and the major way by which there is a absorption of the substances. There is a across the cells, that is said to be the transcellular, and there is a between the cell, that is said to be the intercellular. So this is the way by which the product or the substances, they will get absorbed through the skin. You can see that again, this is the combinational. You can see here there is an intracellular route, here there is an intercellular, and here it is the transappendageal route, which has been very clearly shown. Then the transappendageal route, it is highly permeable. The skin behaves as a passive barrier to the diffusing molecules, and it is suitable for the absorption of the ions and the large polar molecules. So the ions and the large polar molecule, they will get absorbed through the transappendageal route. Whereas the transepidermal route, it is suitable for the hydrophilic drugs partition into the intercellular pathways, whereas the lipophilic drugs, they will traverse the stratum corneum via the intracellular route into the dermis via into the bloodstream. So the mechanism of action by which the material enhance absorption through the stratum corneum is either by the enhancement in the drug release that can be enhanced, that can be improved, and or it is by reducing the resistance of the stratum corneum. So the resistance of the stratum corneum that can be reduced by altering the shape of the skin layer cells, so that there is a permeation or the entry that can be enhanced. And this can be achieved by altering the hydration of the stratum corneum, transporting the ionizable drug through carrier mechanism, and directly influencing the stratum corneum, that is through the chemical or the physical means. So generally the dimethyl sulfoxide, that is the way by which we can go for using this DMSO as a chemical in order to improve the absorption, in order to improve the passage through the skin surface. So DMSO, urea, ethanol, these can be used, and they will going to act as a surfactant which will interact with the keratin structure of the stratum corneum. They will open the tight protein structure, and they will increases the diffusion coefficient D for substances which uses the transcellular route. So you can see the transcellular route, that is just by altering this morphology of the skin layer or the skin surfaces. So generally the surfactants, cleansers, these are going to be used, and there is a entry. You can see the molecule, they will get entered. So the chemical enhancers, they will enter into the structural lipids. They will disrupt the packaging and packing of the skin, and they will make the regular structure more fluid and increase the diffusion coefficient of the drugs. So in summary, what we saw the different mechanisms of the skin penetration and the absorption pathway through the skin. So with this today, we will stop at this particular point only. Thank you very much. Have a good day to you all.